Hello, my name is Alice Munyua. I am a nurse practitioner, and today we're going to clarify one of the videos that I made. I made a video on seizure disorder, and one of my friends called me and she said that she didn't understand what I had said. So I need to clarify some things. I went back and took a deeper look at seizure disorder, and I actually, for the very first time, I noticed there was a problem. And the problem is seizure disorders and epileptic disorders are kind of classified as one and the same thing. They use the word seizure and epilepsy interchangeably. So that's in our textbook, and that's a big, big mistake. So let me just clarify a few things. Seizure disorder can happen one time. Like one time it can occur. Sometimes it does happen more than once. But there is an actual cause as to what is causing it. Now when it comes to epilepsy, epilepsy is a chronic seizure disorder, but epilepsy, there is no known cause for it. So those are the two distinctive differences. And I don't think our textbooks should really be using the word seizure and epilepsy interchangeably, but that's what they do. But when I took a closer look, I noticed that just because somebody has seizure disorder, they don't have to have epilepsy. So they can have a seizure disorder, and remember, seizures are caused by something. There is actually an actual cause for it, but with epilepsy, they don't have a cause. So what is exactly going on when somebody has a seizure? Well, according to the textbook, it is caused by, and let me look at my notes, it is caused by an abnormal electric discharge. So there's an abnormal electric discharge happening in the brain. And as I just mentioned, epilepsy, there is no known cause for it. And there are so many types of seizures, but the biggest and the greatest one, the one that's really more dramatic, is the grand mal seizures, the one that people have disorderly body movement, tonic, clonic kind of movement. And they also don't seem to remember. Like when they get out of it, they are really, really confused. It's almost like having an electric brainstorm in your brain, so to speak, or maybe acid rain in your brain. That will be the kind of thing that would cause a grand mal seizure. But now the question is, what really causes it? Because as I just said, with epilepsy, there is no known cause. And as I have said before, there is always a cause. Even though the cause is not apparent, there is always a cause. And that's why I was getting into the spiritual stuff, and my friend called me and said that she didn't understand what I was talking about. But also when I looked at the research a little bit, I noticed that people don't like to deal with anything that has to do with the spiritual world, especially when it's connected to diseases. They hate to look at that. They think that people who look at that kind of thing kind of backwards, because science has come this far and there's a scientific explanation as to what's causing it. But so when I looked at the science, there is no apparent cause for epilepsy. So where does that leave us? It just takes us back to the same thing. Something is causing it, even though it's not apparent. So let me just recap about what I just said. Just because somebody has a seizure, it doesn't mean that they have epilepsy. So those two are two different things. The other thing that really triggers seizures is lack of sleep. So with seizure disorder, there is lack of sleep. With epilepsy, they could have enough sleep, or maybe not have enough sleep, but they will still have the problem. So, and when we look at sleep, and I've mentioned this before in bipolar, when somebody cannot sleep, there is always a cause for the lack of sleep. Either they're thinking too much, either they have anxiety, they are worried about something, or it could be a spiritual infection. And I'll clarify the stuff about spiritual infection maybe in another video, because then I don't want this to be too lengthy. I will clarify that at another time. And I also told you, I also mentioned the grand mal seizure, which is the most common type of seizure. So, epilepsy has been going on for thousands and thousands of years. So what were people thinking before? Because, when I look at ancient times, the Romans, they used to deal with epilepsy. During the time of Jesus, they dealt with epilepsy. And I actually found out that the Romans used to lock people up. People who had epilepsy. Now, I did not say this. The Romans said it. They said that epilepsy, they thought that epilepsy was caused by demons. And they actually used to lock people up in a room and not feed them in hope that the demons will leave. Now, I didn't say that. If anybody has a problem with that, you have to get in touch with the ancient Romans. But Jesus said the same thing. Now, who's going to have a problem with that? Jesus, on Mark 9, said the boy that was brought to him, he said that boy had a spirit. And he said that was an unusual kind of spirit, the spirit that only comes out with prayer and fasting. Now, I don't know who wants to argue with Jesus, but I don't. And I kind of think that Jesus is right. So, just to recap, when people talk about spirits and how spirits cause diseases, some people get offended by that. And the reason why they get offended, and especially when you talk about unclean spirits, which are also demons, people feel that they are being condemned. They don't understand. They feel that like they are not the right side of God, or there's something wrong with them, or their relationship with God is not right. But actually, that's not the case. When you have this kind of problem, you are a victim of an unclean spirit. It's not that you're on the wrong side with God, or you have done something to deserve it, but you're being attacked. Because let's face it, when people have seizure disorders, medication can heal it. We find that medication only covers like 70 to 80% of the disorder, and actually they don't cure it. If you have to be on medication, you're going to be on medication for the rest of your life, and they only control 70 to 80% of the problem. Now, they can do surgery. They can go and cut parts of your brain. Who wants that? Or they can put instruments like deep brain stimulation. But actually, when I look at it, I think they're treating the wrong thing. Because the mind is actually the one that's affected. Because we know that the brain does not work by itself. The brain is a slave to the mind. So the mind is actually in control. It's the boss of the brain. So when you think about it like that, and then you have to understand how the mind works, which actually most people don't understand how the mind works. The mind is a servant to the spirit. So there is a spirit that's bringing all this confusion, electric energy, and is confusing your mind, and your mind in turn confuses your brain. And that's why most people have this problem. So I hope that explained a little bit. And if you just do what Jesus said, with prayer and fasting, you can actually deliver yourself from this spirit, because it's a spiritual problem. But that doesn't mean that you're doing anything wrong, or you've done anything wrong to deserve this. It just means that you are a victim. Because when most people have seizures, there are certain jobs that they can do. They can drive, they can swim. So you're not going to succeed from this point of view. When you're sick and you have a disease like this and you can't do certain jobs, you're going to be handicapped. And most people are. So you are a victim of something. And the only way to deliver yourself, you just do like Jesus said, prayer and fasting. But now consult your doctor before you start fasting. Make sure you get the support of your doctor. Make sure your doctor is behind that fasting if you're going to go that route. And good luck, because I know that will cure it. If Jesus said it, it has to be right. Thank you.